everyone. So welcome to the first annual Menstrual Awareness Symposium. My name is Kimberly Down. I'm the Associate Director of the Symposium, as well as the President of the HOSA chapter at Canyon High School. And I'd like to thank our sponsors, Period, Birds and Bees Connection, Girl Scouts of Orange County, HOSA, and Natural Care. Without them, this event wouldn't be possible, and we are so grateful for their help. The symposium is hosted by the Period chapter at Canyon High School and Canyon High School's HOSA chapter. Thank you all so much for coming, and I hope you all enjoy and learn something new. Today, the amazing Dr. Rebecca Sauer will be speaking today about the topic, what is a normal period? She's an OBGYN, and Dr. Sauer's clinical interests include abnormal uterine bleeding and fibroids, hormone replacement therapy, menopausal symptoms, adolescent gynecology, and minimally invasive gynecologic surgery. She earned her medical degree at UCI School of Medicine. She completed an internship and residency in obstetrics and gynecology at the David Geffen School of Medicine at UCLA. Her research interests include perimenopausal bleeding and screening for cervical cancer in homeless women. Before we start, I would like to remind everyone to keep your microphones on mute throughout the presentation, and if you have any questions, please type them in the chat, and one of the directors or associate directors, Tiffany, Liba, or Malene, read them out for Dr. Sauer at the end of the presentation. And now I present to you Dr. Rebecca Sauer.
Thanks, Kimberly, for that wonderful introduction. I think my bio has a lot of long words, certainly there, and you did great. Even before that, interesting, I am from Orange County. I was born and raised in Anaheim Hills and went to, Anaheim Hills Elementary School as a child and El Rancho for my junior high. So certainly I'm familiar with this local area, and I'm really impressed and proud of what you guys have done here at Canyon High School in terms of increasing awareness for women's health, menstrual bleeding, and just increasing the comfort around this topic so that girls, young women, and even women of all ages can be comfortable addressing this. I'm just going to share my screen here and go ahead and start this. So what I'm going to talk about today is what is a normal period? And essentially following that, when are good times that you should go see a doctor or go talk to someone about your symptoms? The bottom line is there's a huge variety and huge variation in all women, and there's a large range of what is considered normal. But we also don't want to miss kind of some signs that may suggest that there are other things going that may require additional care and additional support from a physician or a healthcare provider. So just a caveat that this isn't healthcare advice, that if you do have any of these symptoms or you have any questions, that you do seek care with your physician, your healthcare provider, or someone that you trust. This is not healthcare advice, but this is just in general some kind of information about the menstrual symptoms that all women do experience. All right. So today, our objectives, we're going to review normal period expectations, identify variations in periods that can be abnormal, and then describe findings that maybe need to be discussed with your doctor, and list the type of doctors who can help you with your symptoms. All right. So, just as a background, I am an OBGYN doctor, which means obstetrics and gynecology. Obstetrics really means the pregnant patients that I take care of. So I do have the opportunity and the privilege of taking care of women during their pregnancy and also delivering babies. And also gynecology, which is women's care, which can expand from the scope of routine cancer prevention screening, birth control, talking about periods, normal bleeding, abnormal pelvic or gynecologic symptoms that involve the lower pelvic area, including the vagina, the vulva, or any of the women parts. We can address those symptoms with me. I do take care of women and patients who are born with female organs. All right, so the first period, menarche, pronounced as described above, is the first period. And there's a huge variation in when that can be. It can come as early as 9 years of age. It can be as late as 14 years of age for most girls. There's a lot of variations that may contribute to the first period, depending on when your mom or other members of your family had their first period, can determine when you might expect your first period to come. Your weight. Women who are underweight tend to have a delay in starting their periods, and same with also being overweight. Activity and sports. For those who are involved in a lot of activity or a lot of physical demands, competitive sports, etc., may have a delay in their first period as well. Even after the first period, the first 5 years after your first period can be pretty irregular and unpredictable. You know, when we think about periods, we generally think that they should be coming once a month, but until the hormonal axis is defined, that kind of regulates your periods, and that can take up to 5 years for some women, and that is still normal. How often should my period come? On general, about every 28 days, but anywhere from 21 to 35 day cycles are normal. So this is from the first day of your menstrual period to the first day of your next menstrual period are these cycles of 21 to 35 days. Now, again, remember that for the first 5 years of after your first period or menarche, that this may not necessarily be predictable. Most adult women do have 9 to 12 periods a year. So this is after that 5-year point of regulating periods. Most people will expect to have 9 to 12 periods a year. And then most periods on average last about 3 to 7 days. So it's normal if you notice that your periods are 3 days and your friends are 5 days and your sister or your cousins are 7 days. There's a lot of variation. All of it is normal. And that can also change throughout your life. You know, sometimes when you're in teens, it may be 5 days. And then when you're in your 30s, it may be 7 days or vice versa. And that doesn't necessarily mean anything is wrong. It's just all normal variation in how the body grows up and changes. So when should you call your doctor? You know, generally, if you are 15 and you haven't started your period, it's a good time to call your doctor. Or if you notice that you've started going through the changes of puberty, like breast development, and 3 years later, you still haven't had your first period, it would be a good time to call your doctor as well to make sure that there are some rare conditions anatomically that sometimes prevent blood flow from coming out. And some women, you know, aren't born with all the female uterine parts as well. So these are all reasons just to see your doctor to get checked up. If you're 15, you haven't had your first period, it's been 3 years since you have had breast development and still haven't had your period. So that just goes along with, who do I see? So generally, you're going to be seeing a pediatrician, and most pediatricians will take care of children and adolescents until the age of 18. And after 18, will graduate you to a family practice or general practice doctor. So you may have an established pediatrician, and a lot of these concerns can be addressed with your pediatrician, especially if you have a good relationship with them and you trust them. This is something that also you have the right to talk to your doctor about alone, you know, not in front of any parents as well if you're uncomfortable speaking about it. Your family medicine or general practice doctor, some families have a doctor that takes care of everyone in your family, or your OB/GYN or gynecologist, who is a specialist in women's health, including menstrual issues, and certainly have the opportunity to talk to them alone without having your parents there, especially for private issues that you may not want to bring up details in front of your parents. All right, moving on. Premenstrual syndrome. I'm sure you guys have heard of this. PMS symptoms usually start about 1 week before your menses and usually disappear about 1 to 2 days into your periods. And these are a list of a lot of the common symptoms that women may experience: mood swings, bloating, acne, food cravings, hunger, thirst, breast tenderness, fatigue. It all sounds pretty uncomfortable, and it can be, but a lot of these symptoms are really common with a lot of the hormonal changes that happen the week before your period. This is a picture of some of the junk food that some people may crave, you know, before the period comes. But usually a lot of these symptoms start disappearing about 1 to 2 days into your period. Going because of bloating and fatigue. Bloating is when you feel like your belly is full. It can be like full of gas, or you're just feeling like your pants are fitting on as well, and they're really tight because your stomach is feeling enlarged. And fatigue is just feeling tired, low energy, not having, having a hard time waking up, sleeping more than usual. So really all common symptoms with PMS. Acne, pimples is another word for acne. So a lot of facial changes that you may experience. Any other questions about what any of these mean? All right. and cramps and pain that can happen. So cramps are really what are mood swings? Mood swings is just generally feeling either like, it's variable. You can feel sad, tearful, crying, angry, irritable, annoyed easily, and shift between acne. Yes, acne also does mean zits. Yes. So any kind of like facial changes like pimples can happen during the PMS symptoms. All right. Cramps usually are defined as like mild pains in the lower back or abdomen, and that you may experience this also at the time a week before your periods that generally start to get better within the first couple of days of your period. It's usually relieved with over-the-counter medicine like Tylenol or ibuprofen or Midol. I wouldn't advise taking any of these without like talking to your parents or guardians first. What foods should you eat during your period? I think it's highly dependent. There's not necessarily a lot of information in terms of what food makes someone feel better, because a lot of the hormonal things that happen during your period can't be adjusted by what you're eating necessarily. But sometimes there's certain foods, especially like broccoli, high fiber foods, that can cause also more bloating or that gas and distension or your tummy feeling full. So maybe avoid those foods if you do experience the bloating symptoms. And again, everyone's different. Someone might not. Sometimes people do get cranky, and that happens with some of the mood swings and changes that can happen with PMS or premenstrual syndrome. What food should you eat something that are not good? I don't know if that is a question or a comment, if you want to clarify. But I'm just going to move on here from talking about the medications that you can take for some cramps, as long as you've talked about it with your family or doctor. Now, there is a condition called dysmenorrhea. I know it's a long word, pronounced dysmenorrhea, but it essentially means painful cramping sensations. And it affects about more than half of women, almost all women, especially women in their teens and young 20s. This is the pain that can happen in the lower abdomen and back before your periods and during the first few days of your period. Like we talked about a lot of times, over-the-counter medicines like Tylenol, ibuprofen, Advil, Motrin, Midol, these oftentimes make it better. But if you're noticing that you're having to miss school or you're missing work and over-the-counter, the medications are not controlling your pain, that's a really important time to talk to your doctor. There are other options and other treatments that are available but you should talk to your doctor. Has anyone heard of the condition endometriosis or endo? Well, I'm glad we're bringing it up today. Endometriosis is a medical condition that can cause a lot of pain and cramping with periods. It is when tissue from inside the uterus is found in places where it shouldn't be, inside your belly. It can cause symptoms like abdominal pain, pain with peeing, pain with bowel movements like pooping, pain with sex if you're sexually active. And it can cause a lot of pain with your periods. And generally, the pain is not really well controlled with over-the-counter medications like Tylenol or Motrin or Midol. And a lot of times, these girls or young women are missing school and missing work. It's not deadly, but it can have some long-term consequences in terms of pain, and then also it can develop some scar tissue inside the abdomen, inside your belly. It can cause some scar tissue, and sometimes it can lead to difficulty with getting pregnant later in your life. Now, it's pretty rare to have such severe symptoms that women do have a hard time getting pregnant, but it is important to, scar tissue is like when you cut yourself and you heal over it. A scar is what forms, and that can happen like on your skin on the outside. It can also happen around your internal organs from something like endometriosis. And again, this is very uncommon that most women experience those really severe symptoms, but at the same time, these can have long-term impacts later in your life. So I just don't want you to ignore these symptoms if you notice that you are having really painful periods and you're having to miss school once or twice a month because you're having your period or you're, missing some work shifts. This is a good time to talk to your doctor, especially an OBGYN, to make sure you don't have endometriosis. It can affect up to 10% of women at various stages in their life. So good to bring that up to your doctor if you are experiencing that. Any questions so far? So that's, yes.
Chat. Is it deadly?
It's not deadly.
And then there's one more question. It says, what is scar tissue?
Yeah, so scar tissue is like when you cut yourself and then you heal. What forms is a scar. So that can happen on your outside, skin, but it also can happen inside your internal organs with endometriosis in really severe cases. Now, we talked about kind of pain and cramps and PMS, and now I want to talk about kind of the flow or the quantity or how much women are bleeding during their periods. There's a huge variation in terms of duration and flow, or how long it is and how heavy it is. Even when you're having like a heavy flow of your period, or one of those days that you have a lot of bleeding and you're seeing small little blood clots or more solid collections of blood that are coming out on your pad or your tampon or your menstrual cup, that actually can be normal. But if you are noticing symptoms like you are regularly soaking through like your pads or tampons and, going through your clothes or sheets on a regular basis, and you're starting to feel tired or dizzy and weak with your periods, or you have several days where you're having lots of clots with your period, that may be more bleeding than expected. And we want to make sure that you're not getting low blood counts, also known as anemia, because that can make you feel really, really tired and weak and have low energy. Skipped periods. So when you're having, usually periods about once a month, and you notice 1 month that you skip it, oftentimes it can be normal. A lot of things can play into the timing of periods, and also a skipped period can happen, if you're really stressed, if you didn't get enough sleep that month, if let's see, you gained a lot of weight, or you lost a lot of weight, or you started doing more activity. There's a lot of things that can cause a skipped period. And also, if you are sexually active and you are having sex, if you skip a period, it could mean that you're pregnant and you could get pregnant. So if you're sexually active and you have a skipped period, definitely important to talk to your doctor or do a pregnancy test. But in the absence of that, if you have a skipped period, it can be normal. But if it continues to happen, especially with other symptoms, you want to talk to your doctor, because there are some conditions that can happen in women, especially teenagers and young adults, that can lead to skipped periods. If you notice that you have weight gain or weight loss unintentionally, hair growth in unusual places, a lot of acne, also known as zits or pimples, or nipple discharge, which means that you're leaking fluid from your boobs, then you do want to call your doctor and let them know that you're having these symptoms. And a couple questions in the chat box. What is the clots? Clots, C-L-O-T-S, is a blood clot. So sometimes most of the menstrual blood that you experience is like pretty liquid, but if there's any more solid, like formed blood clots, that can be normal unless you're having several days of that in a row. They can look a little bit alarming if you do experience it, but it oftentimes is normal. What happens if you skip a period for an entire year? That is certainly something that's worth to talk to your doctor about, because there are some medical conditions that can contribute to that. So I think it would be important to talk to your doctor if you're skipping a period for an entire year, especially if you used to have normal periods. If your periods last more than a week, that's a really good question. That can be normal. So a lot of women can have periods that last up to 7 days, 7 to 9 days even can be normal. But if you're having heavy bleeding during those 7 to 9 days to the point where you're feeling really dizzy or weak or tired or low energy, then it would be important to talk to your doctor to make sure you're not having low blood counts or anemia, which can cause a lot of those symptoms. All right. And lastly, I just kind of want to talk about bleeding between periods. It can be normal. Women do ovulate mid-cycle, and hopefully you guys talked about this with like why periods happen physiologically or like in the body. What happens is that in between your periods, your body ovulates or releases an egg to try to get pregnant, essentially. And if that doesn't happen, then your body has a period and flushes everything out. Sometimes during ovulation, women do experience a little bit of vaginal bleeding or light period bleeding, and that can be normal. But if you are noticing any other symptoms like itching, burning, pain, nausea, vomiting that happens with the bleeding in between periods, that may not be normal and definitely is a good time to call your doctor again. Question in the chat box. What does it mean if you have gotten a period and the 2 periods were only 6 days apart? It depends where you are from your first period. Within the first 5 years, that can be normal. But generally, that means that you had an anovulatory cycle or that you did not ovulate that month. So sometimes that can lead to more unscheduled or unpredictable bleeding. It depends, if it happens once, it can be normal. But if it happens on a recurring basis, I think definitely worth talking to your doctor for. All right. And just lastly, we talked about this a little bit. What's an OBGYN? What do they do? They take care of a lot of women's healthcare issues, from pregnancy to birth control, period symptoms, and prevention of cancer. So a wide scope of things, and it never hurts to ask your doctor if any of these questions, especially related to your period and menstrual cycle. There's a lot of things that play into your period and it coming normally, whether that's, from your body or from external factors like, being stressed, not having enough sleep, weight gain, weight loss, like we talked about. So there's a lot of factors that we certainly can look at. Another question in the chat box is, can you do anything that can mess up your period? I'm not sure exactly what you mean by that, other than I think, especially like for women who are like competitive in sports or really active, people who travel and then had like a long flight, some of these like things can really stress out the body, and that can either skip a period or create an abnormal period. So your body's pretty sensitive in terms of external factors or things that are happening on the outside that can influence your period. So in a sense, like, yes, there are things that you can do. Like if you normally sleep 8 hours a day and then you go 1 week and hardly sleep, or you have a rapid change in your schedule or travel, abnormal means not normal. These are things that can mess up your period, or if you're usually, not doing a lot of activity and decide to start running 5-6 miles a day, these can contribute to your period pattern, the timing, how often they come, and how heavy or how light they are. All right. So that is really the end of my talk. This is just a picture of me and my family. We took my 3-year-old daughter to Disneyland for the first time on her 3rd birthday. Thank you guys for listening and asking really great, thoughtful questions. I think it's great that you guys are feeling comfortable and open to talk about a lot of these symptoms. And I just encourage you to continue doing it, because this is something that affects a lot of women. And the bottom line is, like, don't be embarrassed. I think it's important to talk about these things. A lot of times things are normal, but sometimes things have other medical impacts and medical conditions that need to be evaluated sooner than later. So it's been a real pleasure to be a part of this, and I'm very, very excited for the future, given all the great things that you guys are doing.
Thank you so much for talking to us. If anyone has any more questions, we still have time to read them out loud and have a question segment.
I see some in the chat, there's a great question. Is there a chance that a girl may not have a period for her whole life? Yes, there are. It's like really uncommon. There are some really rare medical conditions and other ways that women develop in terms of their organs or their internal pelvic structures, that some women actually may never have a period, but it's very, very, very uncommon. Any other questions? Well, thank you guys. It's been a pleasure. Best of luck.
Thank you so much for coming to
You're
speak.
speaking, Dr. Sauer.